We've talked at length about what addiction is, what are the conditions under which it best resolves and is in the chronic disorder is maintained in a state that's in remission, if you will. I want to take a moment to talk about what addiction is not, because this is something that's often misunderstood as well. And I want to talk about the difference between tissue dependence and addiction. And tissue dependence is something anybody can experience. Addiction, like diabetes, you can't make everybody, it doesn't work for everybody. It takes the right conditions for it to work. Tissue dependence is different, though. I can take any intoxicating substance, and all I got to do to make somebody tissue dependent is strap them down onto a gurney for about a month or two and feed them a bunch of the particular substance. And as they start to adapt to that level of it, just start feeding them more and keep increasing the dose until as they develop tolerance, keep increasing the dose. And then as a cool joke, after an extended period of this, all I got to do is just take it away from them and watch what happens. In the case of the alcoholic, their GABA-A subtype neurotransmitters aren't going to be able to catch up, and they're going to go through the classic withdrawal syndrome that alcoholics go through. Opiate withdrawal would look a little bit different. Your stimulant withdrawal is going to look a different way. Cannabis withdrawal is going to have its whole own host of symptoms. And yes, there is cannabis withdrawal, and you can develop tissue dependence with it. All of these drugs, basically you're going to get the opposite of whatever neurotransmitter or neurotransmitters are being affected by them is going to be the result that takes place of that. And so anybody can develop tolerance and withdrawal just by going through this process. It's kind of funny because there's a lot of talk about opiates, and opiates is a big problem in the United States, and that would be a topic for another film, but most people that take opiates will never be opiate addicts. And most people that become tissue dependent, that means they're going to be sick like the junkie on the street if they discontinue using it. Most of them will never be addicts. Most people that become tissue dependent will never be addicts. And I'm going to pick on opiates for a little while just to do that, because we're here in San Diego right now, and in San Diego there's a number of major hospitals, and in any one of them right now there's people there that are staying there longer than they really wanted to when they kind of checked in, and they're under treatment for significant symptoms that are going to be really uncomfortable, painful, if you will. Maybe MRSA infection, where they're keeping it open and having to do treatment over months. All these other cancer. There's just all these different things where maintenance of the individual's comfort level is actually part of their care. And in order to do that, they know that they're going to get them tissue dependent on these opiates. Say I fall down and I break my hip and I have, some complications, maybe an infection or something that keeps me going on this process for an extended period of time. I'm going to end up having to take enough opiates where I start to adapt to them. They're going to increase the dose because they're going to try to keep me comfortable. And at some point in time, I'm going to have to come off of them. Well, they're not just going to say, aha, just kidding, and take it away from you and watch you scratch their eyes out to try and get more, which is probably what even your lovely grandmother would be doing if she really understood what she needed to stop that from happening. She'll do whatever it takes because it would be really uncomfortable, and she might be having a fit just like the junkie on the street would. But after they get her detoxed and appropriately detoxed and get her off of this, and she's through that withdrawal period, your medicine cabinet is safe with your Grandma Rosie. She's not going to be looking, missing it, having cognitive processes, trying to distort reality to make room for it, stealing your medications and then justifying it, and going on other run after run. In fact, if she runs across these medications, she's really not going to have any interest in it at all. In fact, may even see it negatively because it kind of messed with her digestive tract in a way that wasn't very delightful for her. And she's able to have a casual relationship with substances, like most people are. Treatment ends with detox for most people with tissue dependence. In the case of an addict, after detox and discontinuation of substance, even in the case of tissue dependence, and a lot of times that's what people think the addiction is this tissue dependence, it's not over. It's the neuroadaptation that is the addiction. In fact, the neuroadaptation really has nothing to do with the opiates or the alcohol or any of these other things. It has to do with something else. These changes in really what are originally very adaptive structures, the ones that are supposed to prioritize the things in our environment that are important to us, that I need in order to be healthy enough to live long enough to reproduce and rear my young. That's what this physiology is there for. And some of us, there's changes in that. And not everybody's going to experience that. So just because somebody has tissue dependence and they're talking about the avoidance of the negative withdrawal symptoms and they're going to get through that and then everything's going to be okay, that works great for most people. But if they've been through this cycle before and find themselves distorting reality to facilitate the return to the usage and then find themselves tissue dependent again, that's something different entirely, and it really has nothing to do with tissue dependence. That's addiction. And sometimes we use these words interchangeably. In fact, recently, fortunately, in a new manual that people use to describe whether or not somebody has a particular disorder, fortunately, the language was even recently changed, that we're calling addiction, which is this phenomenon I just described, this neuroadaptive changes in some people, and we're calling dependence something else, because it used to be chemical dependency was the language used. Well, anybody can become chemically dependent. That's a separate issue. That's not addiction. And we would call that addiction, interestingly. Oh, they're addicted to the substance. They're going to have withdrawal syndrome if they discontinue it. That's not addiction. That's tissue dependence. And it's something completely different. So that's, if you've ever been tissue dependent and you've been able to just discontinue the use of that and go on with your merry life, and so you don't get this, that may hopefully help you understand that particular phenomenon better.